Hello, everyone, and welcome. We'll be getting started in probably a couple minutes. I see we have quite a few folks who are actively joining us right now. Thanks so much for joining us today. If you are here for our 11:15 Medicaid Waiver Community Engagement webinar, you're in the right spot. We're just going to give it a few moments, a few minutes. I'm going to say aiming for 10:03 to 10:04 for a start time so that we have enough leeway for people to join and get situated. But if you're already here, thanks for being timely. Feel free to grab a coffee or a cup of water and we'll get started in 2 to 3 minutes. We're continuing to have people join us. So if you just got here, thanks so much for joining us. We're going to give it another 2 minutes. We still have quite a few people actively joining this webinar. Once we get to a stable group of folks or we reach 10:04, 10:05, whichever comes sooner, we'll go ahead and get started.
Good morning. I'm just testing to make sure that I can hear.
Hi, Corey.
Oh, perfect. Thank you.
I apologize. You're in the quiet before the storm of us trying to accept all of the folks in the waiting room trying to get in and making sure we're all situated, but we're just about ready to get started.
All right. Sounds great. Thank you.
And I'm not sure who, someone brought us on a whole tour of a building to outside, and that was a little bit fun for me to watch. I got a little distracted, I will admit. So thank you for that. And I'm also glad that, it wasn't a trip to the bathroom. I was like, I'm ready. I'm ready if we have to stop sharing.
Oh my gosh, that was me. I had
No
no idea
worries.
my camera was on.
Hi, Krista, it's Molly. I sent you a side message, like, your camera's on.
Yeah, I gotta bring my kid tennis shoes because they're doing the parade today, the Rose Parade, and so I'm multitasking.
Okay, I think that got us to what looks like pretty stable enrollment, right around 100 folks. And it's also just past 10:05. So I'm going to go ahead and get us started. Thank you all for joining us today. This is our OHP 1115 Medicaid Waiver Community Engagement Webinar. This is a monthly series. It happens on the first Wednesday of each month in both English in the morning and then Spanish in the afternoon. And we are also recording this so that people can have access to it later. As part of that housekeeping, a quick reminder that there are now 100 folks in the room. And so if you can keep yourself muted until there are opportunities to talk, and feel free to use the chat, feel free to use your hand up to get our attention. Just want to make sure that this is a manageable experience for all of us, but is also open to interaction. We are recording this session, and if using the chat or speaking up are not good options, there's always another option, or after this webinar, to use the 1115 waiver.renewal at odhsoha.oregon.gov email address. Now, for those of you who have been joining us for a few months, you'll notice that our next few slides will look pretty familiar, but we do want to make sure that we ground all of our meetings by talking about our virtual meeting practices, talking about equity and engagement. So that's going to be the next set of slides. We're going to try to model doing things like giving visual descriptions of ourselves and stating our names when we talk. I say this as someone who has not done either of those yet and started talking, so I'll circle back to that. And trying to be a little bit slower moving, which is hard for me, but I'm going to try, making sure that I'm being a helpful human for the closed captioning. We also recognize that there is a lot of jargon. There are a lot of acronyms in our presentations, no matter how much we try to remove them. So we will do our best to explain them. If we are not doing that, please hold us accountable in the chat. There are quite a few people here, and I am sharing my screen, so it may take a little bit before things in the chat are addressed, but just know that we are also recording and tracking everything that's in the chat, even if I don't immediately respond to it, which I may not be able to. With that said, it seems like a good time to pause and give some visual descriptions and introduce ourselves. So I will start. My name is Jessica Diaz. I use she, her pronouns. I am a community engagement manager at the Oregon Health Authority. For my visual description, I'm wearing a white floral shirt. I am a Latina woman in my late 30s. I have shoulder length dark hair and I have a blurry background. And I'm going to let Suli and then Molly introduce themselves as well.
Hi, good morning, everyone. Suli Rosales. I use she, her, ella pronouns. I'm a community engagement coordinator, and a visual description of myself is I have brown hair pulled back. I'm wearing a red shirt. I'm a Latina woman with a light skin complexion, and I have a blurred background. I'll pass it over to Molly.
Good morning. I'm Molly Taylor, she, her pronouns. I'm on the community engagement team as well with Jessica. And I am having a blurred background right now, blonde hair down to my chin with an olive colored sweatshirt, and in my early 40s. Thank you for being here.
And I truly wish we could have everyone introduce themselves, but we do have over 100 people in this virtual room. I want to offer our chat as a place to say hello and to let us know who you are. And I hope that we have other opportunities to have more, a little bit more interactivity than we're able to bring in this webinar, but we are going to try to make it as interactive as possible while sharing some updates that we are giving. And this month, we're going to be talking about our waiver implementation timeline and what we know right now. So up next is reaffirming our commitment to health equity and community engagement, have a few level setting slides to make sure we're all on the same page about Medicaid and the waiver in Oregon, and have open time for feedback and questions at the end. Now, these next slides are very important, so I'm going to read them as is on the slide, which is not how I usually like to give presentations, but I want to make sure that I do this right, which is at OHA, our health equity goal. Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender, gender identity, sexual orientation, social class, intersections among these communities or identities, or other socially determined circumstances. Achieving health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments, to address the equitable distribution or redistribution of resources and power, and recognizing, reconciling, and rectifying historical and contemporary injustices. Moving on to our commitment to community engagement. We acknowledge the state of Oregon and its systems has perpetuated institutional, systemic, and structural barriers that have silenced the voices of communities over time. We recognize community engaged health improvement is a long-term and adapting process. OHA is committed to meaningful engagement with communities via traditional and emerging mechanisms for community engagement. We are committed to transparency. Information will be openly and honestly shared so everyone has the benefit of the same information. We welcome feedback about how to make community engagement more inclusive and accessible. And that is a question we will always be asking you at the end of each of these events as well, is how we can make engagement more inclusive and accessible, including this webinar. So I'm going to talk a little bit next about the Oregon Health Plan in the OHP 1115 Medicaid waiver. Just a few terms and basic information. The Oregon Health Plan is Medicaid. Medicaid is the nation's public health insurance program for families, and it has different names in different states, and in Oregon, we call it the Oregon Health Plan. There's a little bit of wonky policy background, but more or less when we say Medicaid, we mean OHP. We say OHP, we mean Medicaid, and a host of other Medicaid-like programs that we've set up to serve folks in Oregon. The Oregon Health Plan is free health coverage, and it's available to individuals, children, teens, and adults who live in Oregon and meet income and other criteria. People can apply for OHP at any time during the year. There's no enrollment time period. You can always enroll. If your situation changes and you were not eligible one month, you may very well be eligible the next month and can reapply. I also want to make sure that we level set by always giving people pathways towards getting and keeping their OHP. Knowing that the waiver is one part of this big constellation that is our health systems and OHP and other public systems. I want to make sure that we ground ourselves by recognizing that people can apply online at one.oregon.gov, that there are also certified assisters who can help, and that this online portal is often the easiest and quickest way to apply, but that's not necessarily what's easiest and best for everyone. So there are also opportunities to apply via a paper form or a PDF online form that can be printed out and filled out either by typing or by hand. There's also a phone line here, 1-800-699-9075, and that goes to eligibility workers who can help either answer questions or help people apply if these other routes are not working. People can also walk into any ODHS office across Oregon and get help with their OHP and other benefits. And if you want to find an assister in your area who can help you, there's this oregonhealthcare.gov/gethelp URL that you can use, and you can put in your address and it'll show you who's in your area. Next up is, what's a waiver? So people are eligible for OHP based on their income or for other reasons. And once they have OHP, there's a whole set of rules, federal and state rules, to really guide what we must and what we are able to offer when it comes to eligibility and covered benefits. So there is this structure that is already built, but we also have some flexibility built into our systems. And one of those is called a waiver. And we actually have a few different waivers with the state, with the federal government. All of these waivers, what they're doing is making a blueprint for how we can do business differently to offer more flexibility, to help more people and cover more services. So when it comes to this 1115 Medicaid demonstration waiver or our OHP Medicaid waiver, you'll hear a few different terms. Every 5 years, we renew our agreement with the federal government here in Oregon, and we propose changes to our programs, and then the federal government chooses if they will accept or reject our proposals. And we had some pretty wide-ranging proposals, and today I'm only going to talk about the things that are currently in that approved world. So there are also some other waiver pieces that are still under negotiations. And I do want to say that up top and acknowledge it. Our overarching waiver goal is to advance health equity, and we know that we can't do that alone. We do have a policy framework that breaks down the drivers of health inequities into 4 specific actionable sub-goals, and you see them here on this slide. We want to ensure that people can maintain their health coverage. We want to be able to improve health outcomes by addressing not only medical needs, but also health-related social needs. We want to ensure that there is smart, flexible spending for these health-related social needs and health equity. And ultimately, we want to create a more equitable and culturally and linguistically responsive healthcare system. And for those of you who have seen those slides a few times, thank you for your patience. I just want to make sure that we have a baseline of shared understanding as we get into the timeline for what implementation is going to look like. There's a lot of information on this slide. And what I'm going to do is show you the slide, and then we're going to walk through the different parts of it one by one. We see that there is one item that has already gone live, and that's early and periodic screening, diagnostic, and treatment for people up to, under age 21. Up next is the continuous eligibility for folks under 6. It's continuous for those whole 6 years. For 6 and over, it's a 2-year period, and that will go live in our systems in July, as we talked about last month. As we move into 2024, that's where we get to roll out the health-related social needs services. And it's also where we begin to transition our prioritized list over to the state plan. I'm saying all this, and I will say it again once we dig into a little more detail on these topics. By 2025, we'll be providing all of the health-related social needs services. So it's going to be phased in. So some of the different populations or specific services may take more time to make sure that we're meeting folks' needs. We also in 2025 are going to start working on youth with special healthcare, not start working on, but start delivering. My apologies. We're working on it right now. Youth with special healthcare needs, really working through eligibility criteria. First, for individuals with high needs, including serious mental illness and complex chronic conditions. And then into 2026, looking for eligibility criteria for people who have 2 or more non-complex chronic conditions. And then you see we have all the way up to 2027 to phase out that prioritized list. So now that I've mentioned a whole lot of fairly complex things all at once. We're going to go one by one through some of this content. EPSDT, early and periodic screening, diagnosis, and treatment, is a benefit that provides comprehensive and preventive healthcare services for everyone who's on OHP under the age of 21. This includes things like screenings, checkups, tests, and follow-up care. And it's extra important because these services help us catch concerns early to prevent and treat illness, and also to make sure that we are better supporting children and youth with disabilities. As I mentioned, this began January 1 of 2023. And starting January 1 of 2023, there are services that previously were not covered by OHP that we are now able to cover. There's a lot that we can say about EPSDT. Consider this a bit of a teaser and me pointing towards more resources for you all. There is a website at oregon.gov/EPSDT. And one thing in particular that I'd like to point you towards on that website is that there are member fact sheets available in a variety of languages, and there are resources. If you are a member and want to learn more, resources for you. If you are a community partner and want to help members navigate what's changed, then there are resources for you there as well. Now, last month we talked about continuous eligibility in detail, so I'm not going to spend a lot of time on it today. And there is a recording of that other webinar if you want to learn more. But just to reaffirm that OHP continuous eligibility is starting in July 2023, and some folks will get this applied retroactively as long as they've been renewed since the public health emergency ended. What this is providing continuous eligibility for children through the month in which they turn age 6. And it doesn't matter when they first enrolled in the Oregon Health Plan, and it doesn't matter if they have changes in their circumstances, like going over income that would otherwise in the past, well, in the current present we live in, but we're almost through. We have one more month. That would otherwise cause loss of eligibility. So OHP will provide 2 years of continuous eligibility for people who are 6 and over. And it's that same deal where even if circumstances change, we can sort of lock folks in. I do want to note that this applies to many aspects of OHP. One place it doesn't apply is long-term care services and supports. And then I also wanted to just say out loud, because these were some questions we got last time around. The situations where eligibility may still close during a continuous eligibility period is if a person moves out of state, if they pass away, or they request voluntary closure. Right now, people will also be suspended if they become incarcerated or justice involved. But that continuous eligibility period is retained once they leave incarceration. So that's a little bit, I just want to offer that clarity and say it as concisely as I can, because I know people had a lot of great questions about that last time around. So now we're headed into health-related social needs. And this is a whole host of different benefits. We are required to roll these out by 2025 in our current talks with the federal government. We expect to begin these services before then, though, starting in 2024. And we're going to start with rolling out climate benefit, and that's in January of 2024, which at this point is only half a year away. And then we also want to make sure that housing and nutrition services go live in 2024, and that looks more like a phase-in system. So this is a place where we might be able to roll out certain services or to certain populations on a staggered timeline in order to make sure that we are doing it intentionally and doing it right. So that's going to be between July 2024 and then into 2025. And I'm going to circle back to what exactly those benefits are, but it is also important to talk about who is eligible for health-related social needs, because it isn't everyone who is on OHP. The populations that we have been given the go-ahead with CMS to offer health-related social needs services are youth with special healthcare needs, adults and youth discharged from an institution for mental disease. That's a technical term that we have to use. But that means people who are in residential psych care, essentially. So the larger residential psych care, 16 beds or more. This also applies to adults and youth who are released from settings of incarceration, youth who are involved with the child welfare system, including youth who are transitioning out of the child welfare system. This also includes people who are transitioning from Medicaid only to dual Medicaid Medicare status, people who are homeless or at risk of becoming homeless. And then when it comes to the climate benefits, this is specifically aimed at individuals with a high-risk clinical need who reside in a region that is currently experiencing extreme weather events. And here's the slide where I get to lay out what we've been cleared to cover for these populations. And they're in 3 major buckets: housing supports, nutrition supports, and climate change or extreme climate. So when it comes to housing supports, we're able to offer rent for up to 6 months. We can cover utility costs, including utilities that are in arrears, pre-tenancy and tenancy sustaining services, case management, outreach, and education, including helping people connect to other state and federal benefits, housing transition navigation services, one-time transition and moving costs, housing deposits to secure housing, as well as medically necessary home modifications, things like ramps. And then when we talk about nutrition supports, that includes nutrition counseling and education, medically tailored meals, up to 3 meals a day for up to 6 months, meals or pantry stocking for children under 21, youth with special healthcare needs, and pregnant individuals. Once again, that's up to 3 meals a day for 6 months, as well as things like a fruit and veggie prescription for up to 6 months. When we're talking extreme climate, that looks like making sure we're able to offer equipment. So that might be an air conditioner, a heater, a humidifier, air filtration devices. If it is medically necessary, we could also cover generators and refrigerators to make sure that things like medication that might need to be kept refrigerated is able to be supported in the event of an extreme climate. An important part of this is to recognize that we are specifically not able to replace existing services or programs, or to in other ways keep people from using other services because we are offering our own. So we have to supplement, not supplant. And that's written into our CMS agreement. So we will need to also make sure that we have a good feel for what the federal, state, and local services or programs look like, and make sure that we are augmenting what already exists, not replacing it. I'm going to talk briefly about changes to the prioritized list because I know it's one of the questions that came up in one of our past webinars. First off, I want to explain what the prioritized list is. So here in Oregon, it's one part of determining if OHP is going to cover a service for members 21 and older. Treatment for healthcare conditions is ranked by its clinical effectiveness and cost effectiveness. And really looking into treatments that help prevent illness, those tend to be ranked higher than services that treat illness after it occurs. And also ranking treatments on a covered prioritized list line for a specific medical condition. So these are the treatments we offer are tied to what medical condition someone has. So between Oregon and CMS, we agree that as the prioritized list currently exists, it was put into our system via a waiver. So a thing that we're trying out and seeing if it works. And at this point, we've been doing it for a while. And so it is agreed that we should transition that into our state plan, which is our business as usual. We have the whole 5-year waiver period to transition this. I will admit I don't have enough technical expertise to know why this is a lot of work, but I have been told by very smart people that it is a lot of work and will take a lot of time and energy to do. So that's one of the things that we have on our timeline. I also want to take some time to talk more about youth with special healthcare needs. And you'll see us using the acronym WISHN for that. And so what this means is that we have expanded eligibility criteria that we are building to allow youth with special healthcare needs to have expanded benefits, including the EPSDT benefits we just talked about until age 26. In order to qualify as a youth with special healthcare needs, someone has to be in early adulthood, so that's 19 to 26, and they need to have a documented higher health need or condition that happened before they turned 19. So they will have the same income levels as children and teens, which is up to 305% at the federal poverty level for folks who know what that means. And that's significantly higher than the rate that a general adult qualifies for OHP, which is 138% of the federal poverty level. And then HRSM benefits will be available for this population as well as continuous eligibility. So just trying to connect the dots on, they will get the exact same set of benefits. They will get the same continuous eligibility opportunity, and we will be able to offer health-related social needs benefits. And as I said before, there are a few different ways we can determine criteria, and that's something that we are currently working to build and will take some time to build with providers, with community, to define what exactly this eligibility criteria will look like. And so this is the broad picture. And I don't yet have answers for the very specific questions you all might have about exactly how people do or don't qualify for this, but we're making it. And then we're almost to our open dialogue, our open Q&A. But I do want to make sure that as we close out the part where I am lecturing at you, that we spend some time thinking about how to help people now. You know, we looked at a timeline, we saw that there's a lot of things that are in the future, but have not yet been fully built. And so there are services and supports that exist for people right now outside of these fancy new waiver opportunities. First off, anyone who has a CCO, there are flexible services, also called health-related services or flex funds you might hear. And so if someone has a CCO, they should talk to their CCO about their needs and to see if the CCO can help connect the dots or help provide services. I do have a few other resources I'm calling out here. I also would love to welcome any of you all who have either local, regional, or state resources that you have found work well for either yourself or for the folks you serve. Please feel free to use the chat to put in additional resources, to point folks towards places where they can get help with things like nutrition, housing, meeting their medical needs, climate-related needs. I want to make sure that while I have a few statewide resources here, I give people the opportunity to share what might work in their community as well. So please use the chat for that. And also that will help us map out what currently exists so that we can help build into it. But while I pause for that, or before I pause for that, I'm going to point out that 211 has a lot of great resources as well. And there's a few different ways to engage 211 folks and 211 information. There's the phone number, email. You can text your zip code to a specific set of numbers, 898-211, to get resources that are local to you. And you can also go to their website at 211info.org. When it comes to nutrition services and support specifically, needfood.oregon.gov has a lot of different resources all put in one place. And there's also flyers and social media images and a lot of other resources for partners as well in at least 11 languages. And so those are just a few, the CCOs and then 2 statewide resources, because I want to make sure that people aren't sitting and waiting for a year in order to get nutrition services when there are a lot of great opportunities out there. And now my favorite part of these webinars, which is the part where I talk a little less and you all share with us. We have some questions here. We don't have a poll everywhere today. We're doing this low tech. We want to make sure you are able to share how you feel about your level of awareness on what we've shared today and the waiver topic more generally. We want to always be asking you, how can we better reach you and engage with communities? And we're always open to learning more about the topics around the OHP waiver that you'd like to learn more about and you'd like us to focus on in the future. And I know there's a very active chat and I haven't had the ability to look at it while I was talking. So I'm going to pause for a second and look at the chat and see if there's anything that we can bring. And also if people want to raise their hands and talk out loud, you are welcome to do that as well. I'm going to answer the easiest question first, which is, will this PowerPoint be available? And the answer is yes. We will be able to send it out, and we also will have it on our public website, as well as a recording of this presentation that you just had here, as well as a host of other resources and information. So we will make sure that this information that we've shared today is widely available for you and for folks who maybe weren't able to make it today. And as I said, I picked that first because it's the easiest question to answer, but I'm going to continue to look through the chat. Actually, I'm also going to welcome Suli and Molly if there's anything that caught your eye.
Yeah, Sean was responding to a lot, which is helpful. I took down some of the ones he didn't have answers to. People had a lot of questions about the housing services and how they will be delivered, which I know we don't have all the answers for yet. And do you anticipate members will need to access climate benefits through their healthcare provider? And some questions about that piece. It's kind of a continued theme.
Yes. I think I do want to say one thing about some of these pieces we've talked about today, which is that we recognize that ultimately what Medicaid does and what we're used to doing is healthcare. And so there's a lot in the health-related social needs that you will notice is not a complete benefit, not complete the way that OHP is complete medical care. So knowing that we only offer 6 months of rent, we know that there needs to be integration into other systems so that we can offer people things that are truly going to stabilize them. And so there are a lot of unanswered questions right now about how exactly that's going to work and the very granular eligibility criteria. The good news I have for you all is that there are deliverables that we are making for the federal government that are going to start to get us towards that in the near future, so we can share in places like here more details, because there's a lot that is not yet built to the point where I have something useful to show you, but we're getting there. So I think if you have questions specifically about like what is the eligibility pathway going to look like, what is the member journey exactly going to look like, that's great content for our future sessions because I cannot give you satisfactory answers today, but we are committed towards building that, and that is something we're actively working on. And I think a lot of the questions relate to, you know, how exactly are referrals happening? How exactly is eligibility being determined? I would love to share more next month. I hope we're at a place where it's ready. And I am thinking that we're likely to delve further into the health-related social needs next month because that is where there's a lot of work being done right now that we can turn around and share with you next month. I also see, I mean, goodness, your questions show a really good understanding of some of the barriers and complexities of things like the climate related supports is we need to be able to mobilize fast. We need to be able to connect people without them having to jump through multiple hoops and wait a long time. Because, well, for instance, let's think wildfire. If we get you an air purifier 2 months after a wildfire has gone near your community, that's not going to help. So those are things that are very much top of mind as we build out our systems and our processes. And then one other fact around the fact that this is ultimately a Medicaid benefit, and if we're using Medicaid dollars, there will need to be medical necessity as part of the criteria. So there will have to be connections to our medical systems, and we're looking into ways in which we are reducing as many barriers as possible, working within the structures we must. And so I do want to call that out. I also see a statement about making sure that we are also building these systems not only for CCO members, but also for people who are on an open card or have fee for service. And I just want to affirm, yes, that is very important and that is a priority as well. When it comes to how we are delivering these for open card, there are some aspects we can't talk about yet due to rules around procurement and making sure we have contracts in place. So I can't talk in detail about the fee for service side right now, but hopefully I can in the future once we have our procurement process squared away. Oh, there are really excellent questions and statements in here. I do want to maybe draw back the curtain a little bit because I think we're right at a place where we can talk a little bit more about engagement pathways that are not this webinar, knowing that this webinar is many things, but it is not a full engagement plan and strategy. And we are working to organize spaces in which we are engaging with CCOs, we are engaging with leadership and the folks who are designing systems at different community-based organizations, provider organizations. We also want to make sure that we are building engagement and communications materials for the direct service providers and coordinators, I think many of whom are you all in this room, and making sure that we are making space to learn and listen and share. And that also we are going to be making more opportunities to engage with members and their families and their communities directly. So I can only speak in generalities today, but I am hoping very soon to have more details on real concrete ways to get engaged very soon. And there are some really great points and questions in here about how to best do that. And I would say the messy way to do that is to email us and bother us and let us know you're here. That's a good first step, knowing that we're also trying to proactively create spaces and we're so close to being able to offer them. And it likely is going to be moving into next month before we can get real movement that we can share, but that there's a lot of work going on internally as well to really push for additional engagement opportunities beyond what you're seeing here today. And I'm trying to stick with things I can say in a broad open forum and not make promises I can't back up. But I think we're at the point where we can start to make these promises that we are so close to having things like models that are built enough for you to tell us what's wrong with them. So very soon. I want to do one call out specifically for what topics you want to learn more about in the next few months. I know there's a lot threaded through comments and questions already, but in the interest of helping make it as clear as possible to us what you want us to talk about, please feel free to put that in the chat at this point. What specifically in our webinar setting should we be working on? And feel free to also throw in things that might have to live outside of a broad webinar where we talk to a really big audience. Very open to that as well. Oh, thank you, Sully, for putting that in the chat. And I see right off the bat is how to engage directly with CCOs. Thank you. I'm realizing I'm going to move us to our last slide just so you have contact information easily accessible. But know that we're still in maybe the last 10 minutes or so of our phase where we want to listen to you all. I see a question that's very specific to an event that's happening tomorrow. And I will say I will be there at the CPOP Summit. So I look forward to seeing you there. If you're going to be at the CPOP Summit, I look forward to seeing you there. And I see a question, which I think is, yeah, definitely a good one for us to bring back versus trying to answer today, which is what parts of the new waiver are dependent on legislation and what are potential impacts? And we can explore that, absolutely. And I don't want to rush us, so I'm going to be happy to hang out for the next few minutes. We've gotten through our content, very open to additional questions and comments. And if there's anything that you want to bring to us outside of this broad forum, know that we're here for that as well. We have our 1115waiver.renewal email address. We do have a mailing list that we haven't quite been able to proactively utilize the way we want to, but know that that is another thing that we are working hard on. And so this subscription opportunity that's listed here on this slide, it will become operational more so than it has been. And we are continuing to update our waiver renewal website as well. And if there's anything at all on the website that you find confusing or want to learn more about, that's also a place where we welcome feedback, and we are hoping to continue to put more information and updated information there as well. And we hope you found this timeline helpful. I know it's not a revolutionary timeline, but I'm excited that we are able to share some concrete details about our plans with you all. All right, I feel like we can stop the recording at this point.